We will provide Marva with her handheld mic as soon as we find it.
Testing.
I warned you. So now I have to modulate my voice. Because if I talk the way I was just talking, y'all could go outside. So what I want to do is to invite some of our activists that are in this room, Luis Malfario, who will tell you about some of the things that he would like to share. You want to stand next to me?
Can I stand next to you?
Yeah, I can put on my jacket.
All right. So I've been asked to tell you a little bit about the work we're doing in Texas. I'm the former president of the Texas American Federation of Teachers, but I'm working now.
You don't have my voice.
I don't. I got to get my teacher voice on, don't I? And I got 3 minutes, so it's like a school board speech. So I'm good at those 3-minute speeches. So I've been working with the Debs Jones Douglas Institute. We sponsored the training yesterday. How many of you were in that workshop yesterday? All right, very good. So in July, we got the state AFL-CIO to pass a strong Medicare for All resolution. And I want to talk a little bit, I want to talk a little bit about how we did that. First of all, there was lots of upward pressure. The Dallas Labor Council, the Austin Labor Council came to the convention having passed their own call for a state resolution. Many of the international unions that have supported Medicare for All were there and speaking out. And we had two dynamic national, international presidents, Mark Dimmenstein from the postal workers and Sarah Nelson, who we heard last night. And so there was lots of discussion about Medicare for All. We were there also the whole time. It was like a Medicare for All bonanza. We were out at the tables. Every time the delegates came out, we were buttonholing people, talking to them. We did a reception. We did a short version of the training. So nobody at that conference walked away from there not having thought about, heard about, and talked about Medicare for All. And we have progressive leadership in the Texas labor movement. Yes, we do. For those of you that know Rick Levy and Montserrat Garibay, that came out of my local affiliate and is a former classroom teacher, these folks get it. They do work with the immigrant community. They do citizenship clinics. So we went to them ahead of time to ask them, what do we need to do to get this resolution passed? So we also believe that we've got to work more to educate the rank and file, right? And so that means giving people tough answers. That means talking to building trades unions who are used to running their own health care programs, who say, if we don't do health care anymore, what's the motivation for somebody to join the plumbers and pipe fitters? We have to have those conversations with our union brothers and sisters. So now what? Now that we've gotten this resolution passed, does it just go up on the shelf? Heck no. We're out now in the labor councils again, meeting with them. We are offering the same training, those of you that went through yesterday, all around the state of Texas. And next Saturday, Chris Rabb, who presented the training, will be with me up in Fort Worth doing this, not only with labor folks, but with our partners from DSA, from Our Revolution, from Public Citizen, from Texas Organizing Project, right. So, and the goal is not just to educate, but to agitate and to ask people to join in. And I'm just hearing now that it's not enough. to get resolutions passed by county commissioners' courts and get Congress people like Eddie Bernice Johnson in Dallas, who told the Dallas Labor Council there were too many poor people in the United States for us to be able to afford Medicare for all. Yeah, you heard it here, long-standing Democratic Congresswoman. So, and we have the Texas AFL-CIO COPE convention coming up in January. So we're working with them to make sure everyone who runs for office gets asked, are you for Medicare for all?
Thank you. Thank you, Luis. These are continuing stories from the front line, and Liz Ortega, who wanted to be up there because not only she thinks she's voice challenged, but she's also height challenged. So she wants to be up on the stage. So Liz Ortega is the executive director of the Alameda Labor Council of California. They are leading the fight against the Trump administration's public charge rule, which would deny immigrants access to health care, and framing it as it is an issue of central importance to the healthcare justice movement. You have your own mic.
Thank you. Buenos dias.
Buenos dias.
You guys ready to fight? You ready to fight? Thank you for welcoming me this morning, talking about wishing you were tall. I was like, I gotta go up there. No one's gonna see me from down there. But thank you for welcoming me here today. I was asked to talk about the fight against the public charge in this Trump administration. But before I talk about that, I want to share a little bit about my story. So I'm the first immigrant Latina to be elected to the seat of Executive Secretary Treasurer of the Alameda Labor Council. We represent 135,000 workers in the county. And while I'm proud of that, my parents are more proud of it because they brought me to this country 35 years ago from Mexico. And while we faced hardships, we felt welcomed. My mom and my dad were not called criminals, and I was not put in a cage. We were welcomed. And like so many other immigrants that share my story, I've worked my entire life to pay that back. But the Republicans have always pursued policies that were based on a bad premise. Their premise is that immigrants come here for free stuff. That's what Trump's so-called public charge is about. It's just another stunt to fan the flame that pushed that premise. Immigrants don't come here for free stuff. They come here for freedom. Freedom to work. Freedom from brutality. Freedom from fear. Of all the things that this man has done, God will punish him for taking away the freedom from fear. Look at immigrants you see every day. You see that fear. You feel them looking away, keeping their heads down, keeping quiet, trying not to be noticed, afraid to walk into a government building, afraid to go to a hospital, afraid to call the police, afraid of something as simple as getting a flat tire on the freeway, afraid that their kids will come home from school, but they will not. But there are a lot of great things about this group here today. The contracts that you guys have won, the patience you have fought for, the love that you give people every single day, it's what makes this country great. And we will win health care for all. I know that being here means that I'm with a group of people who are fearless. Fearless because you speak power to truth. You push back. You call them out. You don't blink. You inspire us all. And for all the fear that Trump has spread, your fearless will give us strength. And for that, I say, gracias a Dios. Let's get this done. Medicare for all, insurance for all. Everyone should be covered. Thank you.
Hello, sister. Thank you, sister. Melinda. 3 minutes.
Thank you.
Let's see how that works.
All right. Well, thank you. Okay. Well, it's a pleasure to be here again. I'm Melinda, and I'm the campaign director for Public Citizen for Medicare for All. And I am really excited to be here with all of you today. Public Citizen, along with most of the organizations that are represented in this room, since April have launched a renewed effort and push to pass city and county council resolutions in support of Medicare for all around the country as a really important piece of our ground game, right? To educate in our communities and to build the movement that we're going to need to win this. And we have created together a comprehensive toolkit, and we've been providing one-on-one support for folks around the country. We've been hosting webinars, training webinars to get people ready to be able to advocate in their communities for Medicare for all. We have a map at our table outside. I encourage you to check it out. We have now over 200 efforts underway around the country just since April to pass these city and county council resolutions, and we want to make that number hundreds more. And I think we can do that in cities large and small, counties large and small around the country. I want to say that already this year, we have passed resolutions in red states, blue states, and purple states, including Detroit, Seattle, Tucson, Chicago's Cook County, Norristown, Pennsylvania, Toledo's Lucas County, and 2 days ago, Tampa, Florida unanimously passed a resolution in support of Medicare for all. This is extraordinarily exciting. We now have over 17 million people living in cities that have passed resolutions in support of Medicare for all, and we can make that number much, much bigger. This tactic has been great because it's relevant in all areas. If your member of Congress is supportive, let's get a resolution to make them feel the pressure even more to be a champion. And if they're hostile, let's get a resolution passed to show that we can build power anyway while it's time to build this. So I'm really excited to work with anyone around this. We're thrilled that next Monday, October 28th, Representative Ilhan Omar and Representative Ayanna Pressley are going to join us in a virtual town hall, and people can join all around the country, and we encourage people to host watch parties for that, so we have information about that. So please join us. My colleague Brittany I encourage folks, there she is, can talk to folks at our table, and we're going to have a workshop right after this on the third floor classroom, and Commissioner Myron, who spoke at the rally yesterday, is going to join us to give her perspective as a local government official, and we will talk concretely about how we can do this all over the country. So I'm really excited to work with all of you, and thank you.
Thank you. So Thomas Kirby is a railroad worker and a BMWED member from Indiana. He was part of the healthcare, not welfare contract fight in the last round of rail negotiations, and his union continues to link Medicare for all to the struggles of all railroad workers for a decent and secure life. And the reason that I'm laughing is when we were out demonstrating yesterday, they had this big sign behind us. They're standing under an umbrella. I'm standing in the rain. And I was trying to convince him to switch places. So now I'm giving you my place. So you
She was a bully yesterday, that's for sure. Good morning, Portland. Good morning. I'm a member of the Brotherhood of Maintenance of Way Employees Division, International Brotherhood of Teamsters. The acronym's not any easier. We are one of 13 unions that represent railroaders throughout the nation. Our union represents the men and women who build and maintain and repair the tracks and the structures and the bridges all throughout the nation that trains travel over. Our union has been endorsing wholeheartedly Medicare for All, single payer, since 2014. Again, at our last quadrennial national convention in 2018, they resolved to continue the fight for Medicare for all. I'm proud to be a part of a union that is not just worried about themselves, but worried about our family and our friends and our communities that we live in. We're lucky. I'm lucky to be a part of that union that does that. Our Medicare for All is an integral element of our internal organizing. Our internal organizing department leads the CAT team. It's a communication action team throughout the nation. That is comprised of approximately 1,700 members throughout the nation for what we call Frontline Communicators, FLCs. These FLC members are brought in for an 8-hour workshop throughout the nation, and then they go back out to the tracks and in the tool houses to have conversations about Medicare for All. That's where the meat and potatoes of these conversations are occurring, out on the tracks throughout the nation. Those FLCs are, to go out there and have those communications, to promote Medicare for All throughout the nation. In our last round of bargaining, we centered on health care, not wealth care, and what was referred to as the 357 plan. The 357 plan refers to the 357 health markets throughout the United States. This was designed to make United Healthcare, Blue Cross Blue Shield, and Aetna, who are the plan providers for railroaders throughout the nation, compete to give our railroaders a better price and save us money. That didn't come to fruition because of politics and everything else, but there's I apologize, don't mean to be stammering. Well, our negotiating team was trying to secure benefits for our members. Our internal organizers and our CAT team were out on the tracks and in the tool houses promoting healthcare for all and Medicare for all for our members. Those conversations are not always easy. We have a lot of areas in the nation that are more prone to healthcare for all, but we're still in that struggle. Our union is getting ready to produce a video, or it's been produced. It's just getting ready to get released. That stars Brother Martin Dudzik to further our advances to reach our members throughout the nation.
Thank you so much, Thomas. So Thomas is, really working hard, and we all know one of the things that's always missing, but being a nurse is always the same, the I don't know. So if you take away the I don't know why we want it, I don't know why we need it, you have a much better chance of making it so. So our last speaker is Katie Robbins of Campaign for New York Health. Katie's going to tell us all about our powerful grassroots campaign that persuaded Congressman Hakeem Jeffries, who gave us a lot of trouble, to sign on as a co-sponsor for H.R. 1380, the Medicare for All Health Act, in 2019. Katie.
Thank you, Marva. Hey, everybody. I am going to start with a little history. I actually served as national organizer for healthcare now about 10 years ago, so I know a lot of folks from that time. And I will say, all morning, I've just been thinking about how Marilyn Clement is smiling down on us today, the founder of this organization. So let's give it up for all the people who brought us to this point. Yeah. It's always good to have people on the other side helping us too, because we need all the help we can get. I will say that I've been working in New York with the Campaign for New York Health and working very closely with the New York State Nurses Association. Do we have any nurses here? Actually, could all the New Yorkers just stand up? I want to see you. Yes, we've got amazing, amazing folks working on this. Yes, yes, yes. And we have come a long way in our effort to pass a single-payer healthcare system in New York State and build the movement nationally for Medicare for all. I like to say our elected officials in New York end up in one of three places. They either retire, they go to jail, or they end up in Congress. So we're educating them on their way to making federal legislation. But also now, after the last election, we can say they might get knocked out of office by a progressive insurgent candidate. But our Campaign for New York Health, which is a statewide coalition fighting for single payer, has grown to over 200 endorsing organizations, over 40,000 supporters in every corner of the state. We have over 500 small to medium-sized businesses that have endorsed this bill. A lot of unions. We can talk more about the union front later on today. We have grown a lot, especially in the fear around the Trump administration in terms of what that means for healthcare for folks. But I think the most important thing we've been doing is having real conversations with real people. We used a survey, the Healthcare Rights and Access Survey, to knock on thousands of doors all over the state. We did a report. We found 50% of the folks who had private insurance coverage delayed or skipped entirely basic care because of cost. And the people who are most impacted, women, people of color, transgender folks, okay? So we have been taking the lessons from having these conversations and saying we need to really root our organizing and think about consistently what it means for this issue to be a racial and immigrant justice issue. Yes. And that is ongoing, minute to minute, constantly evaluating how we're doing our work and how we're making that successful. And it came together in our campaign to move Congressman Hakeem Jeffries, who represents a long stretch, crazy, winding district throughout all of Brooklyn, representing all the communities throughout that borough. And we knew that in order to move him, we needed to really bring everyone together and say Medicare for all is going to make a huge difference for the constituents, and we needed to make sure they knew what we were talking about. So DSA and other folks have been running a ground game for months, having conversations throughout Brooklyn on Medicare for all. And thanks to NNU and their leadership, they inspired us to come together and build a huge, massive event in August as part of the People's Assembly series. And we had an amazing turnout. 150 folks came together and said, we're making it our mission. A month later, Congressman Jeffries was on board co-sponsoring HR 1384. But we could not have done it without thinking about how we were bringing everyone together to move in the same direction in that district. And I'm so grateful for the coalition that made that successful. So I look forward to the rest of the conversation today and tomorrow about how we are going to build the movement that is truly everybody in and nobody out. Thank you.